Care of patients with pituitary, thyroid, parathyroid, and adrenal disorders. Chapter 36. The pituitary gland is considered the master, controlling multiple functions in the body, and many syndromes result from pituitary disorders. Tumors of the pituitary gland can account for 10 to 15% of all intracranial tumors. Pituitary tumors can stimulate the release of excessive amounts of hormones, causing Cushing Syndrome, syndrome of Inappropriate Antidiuretic Hormone, or SIADH, or acromegaly. Damage to the pituitary causes hyposecretions of hormones. This causes Addison's disease, diabetes insipidus, or dwarfism. The routine approach for the hypophysectomy is a transsphenoidal approach via the nose or at the junction of the gums and the upper lip. A nasal drip pad is in place and needs changed as necessary. The expected drainage would be bloody or mucus-like. Clear, watery drainage should be reported. Nasal packing is in place for 2 to 3 days, and the patient must breathe through the mouth. It is important that the patient not brush their teeth, cough, sneeze, blow their nose, or bend forward. Assist the patient with mouth rinses and encourage hourly deep breathing exercises to prevent any pulmonary problems. With giantism, the facial features will change. The lips will thicken, nose enlarges, the forehead will develop a bulge. The hands and feet will become enlarged in adults. The first sign of giantism may be that the shoes no longer fit. Muscle weakness may occur with acromegaly, and osteoporosis as well as joint pain are common. Hypofunction of the pituitary gland is a rare disorder that is characterized by a decrease in the level of the pituitary hormones. The most common pituitary hormone deficiency involves a decrease in the amount of growth hormone and gonadotropins. This decrease will result in metabolic problems and sexual dysfunction. The decrease of the growth hormone will lead to short stature in children. In adults, this will lead to an increase in bone breakdown, causing increased bone fragility and a risk for osteoporosis. The decrease in gonadotropins leads to testicular failure in males and ultimate sterility. The treatment for the hypofunction of the pituitary is lifelong replacement of the affected hormones. Somatotropin, given subcutaneously, is used to replace the growth hormone. Diabetes insipidus is characterized by the production of copious amounts of dilute urine. Diabetes insipidus is caused from decreased production of antidiuretic hormone. This hormone regulates the reabsorption of the water in the kidney tubules. When ADH is not present in a sufficient amount, the water is not reabsorbed from the tubule and it is excreted as urine. Diabetes insipidus was given its name based on polyuria. However, diabetes insipidus has no effect on blood glucose levels. The patient with diabetes insipidus will exhibit signs of deficient fluid volume, tachycardia, hypotension, weight loss, constipation, and decreased skin turgor. If left untreated, the patient will demonstrate signs of shock and central nervous system manifestations. They will progress from irritability to eventual coma from hypernatremia and severe dehydration. For fluid replacement, hypertonic saline is used. It is titrated to match the patient's urinary output. The nursing management will focus on early detection, maintenance of fluid and electrolyte balance, as well as patient education. Baseline vital signs and weight are important to accurately document and monitor throughout the therapy. Strict intake and output monitoring are essential to correct fluid losses and to titrate the IV fluid replacement. The syndrome of inappropriate antidiuretic hormone, or SIADH, is the opposite of diabetes insipidus. Here, excessive amounts of ADH are produced. This results in fluid retention. The pathophysiology of syndrome of inappropriate antidiuretic, or SIADH, is viewed here. There are numerous factors that can cause SIADH. This would include malignancies and tumors that press on the pituitary gland. Tolvaptan is approved for the treatment of hyponatremia in SIADH. This medication improves the serum sodium levels within 8 hours when given as an IV infusion. It blocks the action of ADH. There can be a danger of overcorrection, and sodium levels need to be monitored closely. Hyponatremia produces an alteration in neurologic function and requires intervention. Too rapid of a correction can result in permanent neurologic deficit. Careful monitoring and implementation of ordered fluids and medications are crucial to a good outcome. Remember, ADH is antidiuretic hormone. When it is present, it prevents diuresis. When it is absent, the kidneys will release more urine. Iodine preparations need to be given in well-diluted fluids and administered through a straw because they can stain the teeth. Adverse effects of iodine preparations may include a gastrointestinal upset, metallic taste, skin rashes, allergic reactions, and epigastric pain. Patients at greatest risk for hyperthyroidism are adult women between the ages of 30 to 50. Primary hyperthyroidism is the result of an abnormality of the thyroid gland functioning. This causes excessive circulation of the T4 and T3 hormones. Secondary hyperthyroidism is the result of an abnormality in another gland. Think of the pituitary gland producing too much thyroid-stimulating hormone and overstimulating the thyroid gland. Some cases of hyperthyroidism are misdiagnosed as cardiovascular disease because the symptoms are very similar. The main symptom manifested with hyperthyroid are the result of accelerated metabolic rates and speeding up of all the physiologic processes. Tapazole is the main antithyroid drug that is used. The patient must take the antithyroid drug at a prescribed time and strictly according to a schedule. Radioactive iodine 131, known as ablation therapy, is a definitive treatment for hyperthyroidism. It will destroy the thyroid tissue. All patients that receive radioactive iodine must be observed for signs of thyroid crisis that can result from radiation-induced thyroiditis. The nurse provides patient instructions regarding taking iodine preparations. It is important for the nurse to include: dilute the preparations well, use a straw to prevent staining of your teeth, watch for easy bruising, report severe epigastric pain, anticipate a metallic taste. The correct answers 1, 2, 4, and 5. Another cause of a thyroid storm may be improper reduction of thyroid secretions before surgery. In a patient with hyperthyroidism, thyroid storm can also be triggered by other factors unrelated to surgery. A thyroid storm may be caused by a patient with hypothyroidism who consumes an overdose of levothyroxine. The treatment of thyroid crisis must begin immediately after the first symptoms are recognized. A patient receives large doses of radioactive iodine for hyperthyroidism. Appropriate nursing interventions include monitor vital signs, restrict fluids, encourage eating high-calorie foods, properly handle contaminated materials, encourage physical activity. The correct answer, 1 and 4. Adults who have myxedema or a very low thyroid production have a decrease in appetite but an increase in weight due to the slow metabolic rate. Signs and symptoms of hypothyroidism are cold intolerance, constipation and abdominal distension, flatulence, impaired memory, depression, husky voice, thinning eyebrows, hair loss, brittle nails, easy bruising, fatigue, muscle cramps, numbness and tingling, dry skin, and non-pitting edema. The results of the treatment of hypothyroidism are magnificent, and most patients show a remarkable abatement of their symptoms. Autoimmune thyroiditis, or Hashimoto thyroiditis, is a chronic form that usually affects women between the ages of 30 to 50. The body will produce antibodies against the thyroid, which in turn will destroy the thyroid gland. The goal of treatment is to decrease the size of the thyroid and to prevent hypothyroidism. The first sign of thyroid cancer may be a nodule found on a routine physical examination. Only 5 to 10% of nodules found are cancerous. If the nodule presses on the trachea or the esophagus, the voice changes, there may be trouble breathing, or trouble swallowing may be present. Treatment for thyroid cancer is a thyroidectomy. Radioactive iodine therapy may be used in place of surgery to disable the gland. Hypoparathyroidism may occur due to an accidental removal or destruction of parathyroid tissue during a thyroidectomy, or irradiation of the thyroid or parathyroid, neck trauma, or idiopathic atrophy of the glands. A deficiency of the parathormone will cause decrease in serum calcium levels and an increase in phosphorus levels. Chevet's sign is a muscle irritability when the facial nerve is gently tapped. Trousseau's sign is a carpal spasm that is elicited by inflating a blood pressure cuff 20 millimeters of mercury above the systolic blood pressure. Tetany is considered a serious sign that results from a lowered serum calcium level. Muscle twitching and spasms occur because of extreme irritability of neuromuscular tissue. If calcium levels continue to fall, the patient will suffer from convulsions, cardiac dysrhythmias, and spasms of the larynx. Acute hypoparathyroidism tetany is treated with IV calcium glutamate. This will raise the serum calcium levels to a normal range and given with vitamin D. Oral or parenteral administration of calcium salts is used in the acute phase. Chronic hypoparathyroidism, the treatment is aimed at restoring and maintaining normal calcium levels in the blood. This may be accomplished by parathormone replacement therapy, administration of vitamin D in massive doses to enhance the absorption of calcium from the small intestine, and oral administration of calcium salts. Remind the patient that therapy for hypoparathyroidism is lifelong and advise the patient to wear a medical alert bracelet. Hyperparathyroidism is an endocrine disorder where excessive parathyroid hormone is released that is unregulated by calcium levels. Secondary hyperparathyroidism will occur because of hypocalcemia that is due to deficiency of vitamin D. The signs of hypercalcemia are manifested in virtually every major system in the body. The nursing management for patients on diuretic therapy include an accurate measuring of intake and output, daily weight, monitoring of serum electrolytes, ongoing assessment for electrolyte imbalance, and appropriate nursing interventions. Catecholamines are epinephrine and norepinephrine. In Pheochromocytoma, this causes severe hypertension, and if left untreated, it may lead to death. Before adrenalectomy surgery, the patient may be in a hypertensive crisis and require close monitoring of vital signs and the administration of IV hypertensive medications. The patient must be monitored for signs and symptoms of side effects related to high doses of medication therapy. Addison's disease is characterized by a decreased functioning of the adrenal cortex, causing a deficit of 3 hormones that are secreted by the adrenal cortex: cortisol, aldosterone, and testosterone. The major problems related to insufficiencies of mineralocorticoids and glucocorticoids. Insufficiency of adrenergic hormones compensated for by the ovaries and the testes. The disorders causing a primary insufficiency include idiopathic atrophy, autoimmune disease, inflammation, infection, and non-secreting tumors of the adrenal cortex. Secondary insufficiency occurs when the pituitary gland fails to secrete ACTH because the gland is underfunctioning or was surgically removed, as in a hypophysectomy, or after abrupt withdrawal of steroid therapy. Replacement therapy is to provide the missing hormones. This usually brings about a rapid recovery, but the patient must continue taking the hormones as a lifelong therapy. Cushing syndrome is caused due to an excessive secretion of ACTH or a secreting tumor of the adrenal cortex. Unusual growth of hair or hirsutism may occur in women with Cushing syndrome. There may be streaked purple markings in the abdominal area that occur because of collections of body fat. When providing a corticosteroid medication, take baseline vital signs because steroids may elevate the blood pressure. Assess for signs and symptoms of infections. Never stop steroid therapy abruptly because abrupt withdrawal may cause death. Give oral doses with food to decrease GI irritation. Monitor older adults for osteoporosis. Watch for signs and symptoms of depression in patients on high-dose steroid therapy. Monitor for signs of hypokalemia. And monitor the blood sugar of diabetic patients because glucocorticoids may cause hyperglycemia.